Past, Present, Future. Exploring Applied Sociology with Substance Abuse Disorders by Macy Taylor. This presentation will explore how sociologists affects the research of substance abuse disorders, practitioners in the fight for recovery, and how sociologists are uniquely qualified in helping understand the broader view of drug and alcohol use, how the public views it, and how those struggling view themselves and their path to recovery. Rising death rates call for more innovative treatment. By this chart, clearly you can see that overdose rates have been on the rise since the turn of the century, with an upward spike at the time of the pandemic. Sociologists, using survey data and qualitative interviews, can get to the heart of the rising use and devastating death toll to provide personalized insight as well as empirical data to observe the social determinants of substance use disorders. There are many practitioners using applied sociology in all corners of helping to solve the issue of substance abuse disorder. Public health groups funded by the government include the National Center for Drug Abuse Statistics, the National Institute on Alcohol Abuse and Alcoholism, the National Institute on Drug Abuse, and the Substance Abuse and Mental Health Services Administration, all of which are working with the Department of Health and Human Services. There are medical specialists working on advances in neuroscience, neurobiology, and in understanding the long-term effects of drug and alcohol use, especially good for medical sociologists. Also, there are nonprofit and for-profit recovery centers that provide on-the-ground resources and a place for active recovery. Also, working with them would be community integrators working with all of these organizations to inform the public and reintegrate those recovering back into active society. All of these places have a place for applied sociologists, and all use sociological research to guide them in their mission. Sociologists have the unique credibility to examine history and to see where things went wrong, and also how to begin a road to correct them. In the 1970s, when the Nixon administration declared a national war on drugs, the focus on harsh punishment and a by-fear-based approach to substance abuse disorders was started. It was then accelerated in the 1980s as it was a key characteristic of the Reagan administration and First Lady Nancy Reagan's Just Say No campaign. Now, looking back and at the present, it is widely considered a failure and instilled ineffective policies. The punishment-based approach has left us with mass incarceration and crowded prisons, with no off-ramp for those to return to a better life by withholding opportunities such as employment, civil activities for those in long-term recovery. A more civil, holistic, medical, and research-based system is needed, and applied sociologists can help shape the evolution of these issues. The current state in substance abuse disorder treatment is focused on evidence-based treatments. Evidence-based treatments focus on finding the best treatment available, treating patients efficiently with a research and science-based approach. Cognitive behavioral therapy focuses on educating individuals to identify and overcome beliefs that influence their behavior linked to drug and alcohol use. Contingency management works to offer incentives and rewards for continued sobriety to promote continued recovery. Motivational enhancement therapy helps individuals realize a personalized goal and collaborate with their counselors to find their unique plan for recovery outside one-size-fits-all models. Family-based therapy brings families together to find causes of substance abuse disorder within family life and ways to make positive changes together. 12-step facilitation therapy is the long-standing Alcoholics and Narcotics Anonymous program that provides groups designed to support each other living with addiction and moving through the steps of recovery. Medication for substance use disorder helps provide the respective medication for those experiencing withdrawals as well as maintaining recovery going forward. Finally, peer support services using group therapy and support groups to help people in treatment and afterwards. All of these are candidates for sociological research that can aid them in their effectability and to examine what works for the right people. Applied sociologists are crucial in understanding the social determinants of health and substance use disorder. Helping understand the environments from which SUDs arrive can in turn help define a broader context and the societal causes and changes that must be made to curb this crisis. Social determinants include economic stability, focusing on employment, income, job opportunities, food security, poverty, as well as parent socioeconomic status when dealing with children and adolescents. Neighborhood and physical environment explores housing, transportation, geographic area of residence, neighborhood instability, and population density and characteristics. Education is a factor looking into attainment, early childhood health education, and race ethnic segregation. Social context and community looks at family systems, social networks, stressful life events, discrimination, exposure to violence, trauma, and criminal activity. Finally, healthcare provides insight into insurance coverage, pharmacy availability, access to care, and quality of care. All of this is attained by sociological research, and applied sociologists use this to inform all of the agencies and organizations discussed in this presentation. Future possibilities. One to consider is normalization of addiction. Normalization can be a process that can destigmatize addiction and create a world where addiction is understood and accommodated when necessary. This creates a collective approach and moves away from pathologies and individualized addiction disease. Borrowing from Karl Marx's critical theory, sociologists can analyze substance abuse disorder through a critical lens, offering explanations of economic power causing addiction crisis through systemic discrimination and also the desperate economic climb forced on all members of society. Changes in language we use can also help us move forward in destigmatizing substance use disorder, from addict to person living with addiction, and from drug abuse to drug use disorder. These small changes can create a new landscape to how we collectively feel and talk about these issues. Harm reduction is a new technique used to prevent overdoses and deaths by having community awareness of what drugs are being used in a specific community and information about deadly batches circulating and even safe environments for users to use drugs safely. Though viewed as some as a controversial approach, the goal is not to promote drug use, but rather to educate the public and reduce the harmful effects of drug use as well as prevent overdoses and other complications. These progressive steps are all in the spirit of human existence and collaboration. That is the goal of applied sociology, to assist communities to come together and help collaborate on a shared vision of human life.